as you have already said that Phaco vitrectomy by a single surgeon is good, and as Bhavan sir was mentioning at the beginning of your discussion that my wife is a Phaco surgeon, and that's why probably I'm in this. I'm debating on this, but if you look at it, as you have already told, Phaco vitrectomy is becoming the routine in most practices, and that's because patient comfort. We can avoid multiple surgeries, post-op care is better, and the surgeon comfort is there, hospital comfort, ease of billing, ease of patient care, and insurance claim may be a hassle, but then yes, that is a different issue that we'll need a separate place to discuss about. When I say Phaco vitrectomy as a two-surgeon approach, if I look at it from the patient's perspective or the patient's outcome and comfort, the patient would always be happy that his regular doctor is operating on his or her cataract. When I mean that his or her regular doctor, it means that most of the times these cataract patients with some VR problem are referred to the VR surgeon by the anterior segment surgeon. And he or she is a regular patient with the anterior segment doctor. And when the patient on that table knows that his or her anterior segment surgeon or the cataract surgeon who had referred the patient to the VR surgeon is going to operate, their comfort level is totally different. So we have to look at it from the patient's perspective as well, rather than just looking at it from our side that, we are saving time, we are keeping the money. And obviously, as you had mentioned in your slides as well, that, we can have a better outcome of surgery done by a trained Phaco surgeon who's doing these kind of cataract surgeries or Phaco surgeries day in, day out, probably doing about 10 to 15 a day, and we would be doing much less. So, all in all, there are lesser chances of complications, and we have a happier patient at the end of the day. Then I would also like to look at the surgeon's comfort. Definitely, I will be having palpitations when I have to do a cataract in a patient which is already a VR case. Already I will be stressed out with giving the best possible outcome as regards the VR surgical outcome is. And in that, or on top of that, I will have to take care of the Phaco as well. So reducing my palpitations, reducing my stress would be of prime importance. If my stress levels are less, that would reflect on my surgery. So that is there. The second thing that I would want to stress here is Phaco training has to be done after we do a VR training. I can name most of the big institutes in the country which are giving very good VR training to all of us, but none of them incorporate the Phaco training component at the same time. And I would want to ask you directly, how many PGs passing out of most of the institutions across the country, mainly the government institutions, tend to get Phaco handpiece in their hand? Forget about Phaco surgeries. They don't even know to do, they get hardly about 20 to 30 Phacos. I'm talking about medical colleges. DNB, yes, in Arvind Eye Hospital, Shankar Netralaya, Shankar Eye Hospital, LV Prasad, they all do quite a few surgeries. But I don't think medical colleges across the country give more than 100 cases of cataract. Forget about the Phaco part now. So ultimately, we have to do a Phaco training in addition to our VR training. So we are again going to waste another month or two just doing Phaco training. Additional time consumption, you have already mentioned about it. Yes, I would take it as 14 minutes on before my surgery starts. And at the end of the day, the anterior segment surgeon is happy because he has operated upon his own patient, and there is no loss of revenue or no loss of patient for the anterior segment surgeon to a VR surgeon. The hospital billing, yes, the billing team is very happy because they can always charge the surgeons, which can be added to the billing, and the insurance claims can be enhanced by adding a visiting surgeon charges to the VR surgery or to the cataract surgery. Sorry. So all in all, it is a win-win situation for all. Then why should we not do a double surgeon approach for phaco vitrectomy? Thank you.